22
for
IM.
IM.
22, 1.5.
Yeah. So what's the order? 3 mLs or
Somebody
something?
get a picture of him.
He's
He's
killing
sitting on
someone.
Okay, so you're
Patient's
giving Depo-Provera. What is Depo-Provera?
Contraceptive.
Right, contraceptive. Very good. Very good.
Okay.
And it's 150 milligrams in 1 ml.
Okay.
Okay?
So 1 ml.
And your order is 150 milligrams.
Okay.
That's
So
a
the
tough
first
one.
thing I'm going to do is
Let me take
check the order.
Right.
Make sure the order is complete.
So there's your order right there. See if it's
Okay.
complete.
So I'm checking the order.
So what 5 things does the order have to have?
It's got to have the right route, the right time, the right patient, the right dose, the right date. Did I forget one? Medication. The right medication. Okay. And it's complete.
Okay.
And so you said in 1 milliliter?
Yeah.
Okay. So I'm gonna,
So the drug, do you have a drug thing right there? So that
Yeah,
drug,
so
so
there's
just
my
read it
drug.
and look at it and see what it says.
and I'm going to recheck, making that sure it's matching the order, and it's correct for now. And so I'm
So-
going to grab
So what does this drug say? You have Depo-Provera what? It's actually
Depo-Provera.
going to say,
You said 150
Milligrams.
milligrams in 1 mil.
no, that's what you're going to end up giving, but you have to check here and see what
Right.
it is. If this says 300 in 1 ml, how much would you give?
So I'm going to give 0.5 mils.
So you have to check your bottle to see
Right.
what's available.
It's just hard to
Right.
pretend.
Yeah,
I'm trying to remember what you said.
because the drug, I mean,
Right.
the order is not going to tell you how much you have to give. They're going to tell you 150 milligrams, but you have to see what is provided, what you have available, to determine how much of the actual liquid you get. Okay?
So I'm going to grab a 3 mil syringe, but there isn't one. Can I use a 5 for now? That's
It's easier with a. Did you go over there and look for one?
no.
You know where they are, right
Yeah.
above the thing.
This commercial break is brought to you by.
All right. So I'm going to grab all my equipment at this point. So I have my 3 mil, I have my alcohol swab, my blunt, my swab, and okay. So start withdrawing the meds.
Now, sometimes you can also have a Band-Aid in case they have a low bleeding, right?
That I didn't see that back there.
There's no Band-Aids?
I didn't see it. You see
Okay,
yesterday?
I'll
I cut
No,
myself the
that's
other day
amazing.
and I couldn't find one.
Really?
Right.
So we need to put some out. Okay.
Okay.
We can have the pudding ones. I think they're like
Batman.
So I'm going to withdraw 0.5. You said. Wait.
No. I said
That
you
was
had to check.
pretend. So
This is 100, you just read it. It said 150
Mm-hmm.
milligrams in 1 ml. That's what you just read.
right. But,
So you're going to give 150 milligrams.
right.
So
So
how
I'm
much are
going
you
to
giving?
give 1.
Okay.
But then you presented that other scenario.
Well, I just said you have to check and see what the bottle has.
Okay. So
The order doesn't tell you what the bottle has.
I'm going to inject in, and then withdraw.
So everybody has to do this. You have to inject air, you have to do it, because otherwise you'll be like this. When you come to the floor, the patients don't want you to see you like this, okay?
Now, actually, back up. Back up.
Put the
I
real- put the
swabbed.
real
I swabbed first. I
Yeah.
swabbed first, and then I took
Okay,
that
now let's
out.
just go over the swab. How do you
Yeah.
swab?
For like from the inside out.
Yeah, you don't just keep doing it,
Yeah.
because obviously you're bringing things back in, right?
From the inside out.
Right.
So
So, 15-minute scrub is really not.
okay, and then I did that. Okay, so now I'm gonna pick that back up. My hand's shaking. I'm nervous. Okay. And at this point, I'm gonna recheck with the order, and so
Okay.
that I've got the right amount, which is 1 mil. Okay, and then I'm gonna go and bring.
So how many times has he checked?
This is second time.
This is a third, isn't it?
Second
Yeah,
time.
third time. So that's how many times you're supposed to check, right?
Okay. And then where's my needle? Where's my needle? It's in here. I'll just use this. What is that? 1.5? Yeah.
Oh, wait a minute. Don't open that up. Well, I guess you can, but I mean, then we
I
can't
would
use that
take-
syringe. We can use that syringe, I guess. Go ahead.
Because
Because the other ones aren't safety.
22.
Yeah.
I bought a whole box of safety.
There's a lot of
I'll be
safety
right here.
ones. Okay. So I'm gonna take that along with this and a Band-Aid to the swab, the alcohol pad,
And gloves.
and the gloves with me to the bedside. Now we're at the bedside. I ID the patient. Can you tell me your first and last name? Check it against the ID band. Date of birth. Checks out. Okay, and then I identify the site of injection. And what are we doing? Deltoid upper third of arm.
No, we're doing this one first.
Oh, we're gonna do
We
that.
haven't, we haven't gone over that one yet.
Okay, so you want
Or
me
do you want to take a little break and turn it off? And no. Okay, so we'll do this one.
Okay, all right. So I'm gonna put all this down here. Okay, so this side. So I'm going to use. I'm gonna use my left,
Very good.
and I'm going to. Okay, so I'm
She's a
going
pro.
to first ask you to bend your leg so I can find the trochanter.
And so you have to feel, right?
Yeah,
I mean,
yeah.
you have to touch people.
Right.
And that's one thing, you're going to be touching a lot of boobs, vaginas, everything. So you just have to get used to touching, okay?
So you're bending your leg.
Because you're not a visitor, you're a nurse.
There's your trochanter.
Okay.
And then I'm going to take.
We'll just use this hand and try to find the crest up here. Because see, it's kind of hard to. Okay.
There you are. There's the.
So where's the crest and where's the anterior iliac spine? Remember, you can just feel it because you can feel it. It's just like a.
It's easier to find the anterior first.
Yeah, for me.
Okay, so find that one.
Yeah, there you are.
Okay.
There's the spine.
And now are you
then-
still on the trochanter? Are you too far up? Let's see. Okay, this is a trochanter. So your palm is on here.
Right.
Now, this one's going to be going towards this. Whether he can touch it because he's actually up there. But
Right.
a lot of y'all will not be able to. So go here first. So there you're going to get it right there.
Okay. So, see, I couldn't feel the crest. There, it's very clear now. Okay. All right. And so my injection.
Is your hand still on the trochanter?
Not.
If your hand is not on the trochanter, you're going to be too far up and you're going to give it in bone. See,
But I just go like this?
Yeah, feel with the other hand.
Yeah, but that is those are your landmarks.
Okay.
Palm on the greater trochanter, this on
Okay.
the anterior iliac spine, this on the crest,
Okay.
or towards the crest. And there.
Just
See,
my
this
habit is
one-
like once I feel the actual spine here, I feel like I'm in location.
No, you're not, because you're going to give it up here. Fill up here. This is where where you have
Yeah.
total bone, so you have to give
Yeah.
it down here.
Right.
If you don't have this hand on the trochanter,
You're gonna be too
you're
high.
going to be too high.
Okay. So
So
can I
you
do that
have-
one time really fast?
Yeah,
Okay. So you're bending your leg.
yeah. You're finding the trochanter,
Found it. Found it. Okay.
and you can use this. You can use two hands if it's easier to find
Right.
that crest with the other one, right?
Right. And also, you're gonna have scrubs on or something, like pajamas.
Yeah.
It's easier.
You could just pull her gown away, right? Because she's going to have to be, or he or she's going to have to be uncovered to give the shot.
There it is.
So it'll be easier than with clothes on, right?
Okay.
But remember, if you don't put your palm on this one, you're definitely going to be too far up. And if you have short fingers, your tendency is going to be to come up and touch the crest, but then you're going to be off of the palm, and then you're going to be on against the bone. See, if you give it up here, so this is just pure bone up here. So if you're not keeping your hand on this trochanter, then that's where you'll get it.
Could you wear like a skeleton costume that day?
So then I'm gonna switch out. Line. Whoops. That's not gonna happen.
I'll
I'm
wear
gonna throw
bikini.
this in the sharp spin. And I'm going to swab the site.
Now, how many times do you go around the same thing again? You go in the inside, around, and out.
Okay.
Don't
Okay.
Give it,
All right.
give it to Professor Carr.
3 times. That's fine. Oh, really?
No.
Okay.
If it was a PPD, I'd let you give it to. That's the only injections I accept.
Okay. I'm gonna go at 90 degrees.
Okay, so wait a minute. Do you compress or do you
Z-track.
spread or do you do? No, you don't have to. Which ones do you have to do Z-track for?
Oh,
Back up. Back up. Actually, before I even did that, I put on those gloves that are too small
Oh, so
for me.
put them on.
They're really too small.
They don't have large.
I couldn't find them.
Let's
want
look
me
over
to-
here. Could you?
I can squeeze them in. It's
Okay.
just hard to do it.
One of those are tight.
They're really tight.
Why is he not putting his gloves on when he's getting his equipment ready?
Because they'll be contaminated.
Are they clean? I mean, are they?
No, it's because
They're
the
not
whole point of the
sterile.
gloves is to prevent the fluid from.
The only thing you're using gloves for is for you not to get contaminated with
Yeah.
blood, right? Always remember, think, why am I putting on these gloves? And once then you know when to put them on. So the only reason is because you don't want to get HIV or something, right?
Right.
So you're not Here's
It's okay.
the-
It's okay.
What do you
Okay.
put
It's
on
over.
before?
So
You put, what do you put on before
three
you start
times I
finding
did that
landmarks,
right.
so
I
you
put on the
get
gloves
landmark and you
before.
just go straight instead of
I don't know if
finding
it's.
finding it again.
I don't know if it
That
makes
is a
sense
good-
on the video.
Okay, so now what's your name?
Ahuva.
What?
Ahuva.
Ahuva. I never heard that one before. Okay, Ahuva. So she's saying, wouldn't it be better to put your gloves on before you found the landmark? So once you see the landmark, you don't have to
You don't
take
wanna
this
take
whole
your
time
hands
to.
off. So then
That
when
might
you
be a
take it
good
off,
idea.
get your stuff, then you're gonna have to find it again.
Well,
And
they
then
usually.
What's the point?
Like if Jake
When
goes in
you
the
do it
building or
first,
something,
just
we're
take
supposed to
like
be like prepping meds in that room, like in the med.
Right.
We're like we can't go in the hallway with your gloves and
No,
everything.
but put them on at the bedside
bedside,
before you
before
look for
you
the
feel-
before you find your landmarks. That seems to me makes sense, right?
I like to touch people without gloves.
Oh, go
it's like that?
go do
No,
it.
I have more like tact.
You have more tactile
what they
thing.
do
you
is in
really
the
do.
hospitals they
You
just
need tight
pluck off the
gloves.
top, the tips of the fingertips.
I never seen that.
Then you don't get, I did that before. You just wear your
And how does that
And
protect
what's the
you?
point?
I don't know, just to feel it, just so you can feel it.
Oh.
And then just because she's the gear was like if you have the glove and without it, it's two different feelings. So then I just did it just to see the difference between without it and with it.
Oh,
Obviously,
okay.
I took it off and put it back
Oh,
on. Back
okay.
on. But they're just showing you what the whole point
So
is.
Okay.
so
okay.
we already ID'd, and I'm putting on gloves, and I already swabbed 3 times, and now I'm going to inject them in the middle.
Does it matter
Okay,
what
so wait a
bevel
minute.
side?
Are we spreading? Are we bunching? What are we doing?
Spreading.
Spreading.
As I am, right? Okay. Right. So spread.
Now let me just show you what. Okay, go ahead and do that. No, don't do that. 'Cause I wanted. Oh well, I wanted to just show you. Okay, so let me just show you one other thing you can do.
Okay.
So you spread, right? You have your cotton here, your little swab. You spread. Do it like this, and then you hold it while you're giving it. So if you're shaking or anything, it's not going to be transmitted to the patient. So you have
That's why she was doing that.
you have your hands on the patient like this, and then as soon as you push it in, then you hold it,
How
press
much
it.
of the needle should go into the skin?
Well, just see how much you. I mean, you certainly would. You ever put it up to the hub?
No.
Never, because if it gets broken off, there's no way to get it out. I always,
Halfway?
you know, if it's a really fat, I'm using fat. If it's very overweight person, an obese person, I'm very politically incorrect. And you know what? I sometimes say Oriental, and my husband and daughter just cringe. And just, how could you say? I said, I don't know. There's some things from my past that go with me. I'm sorry. But, so, if it's a very obese patient, then you obviously you're going to put it in more. Oriental. If it's a fat Oriental person. Okay. So anyway, so you don't put it all the way in, and if it's a very obese person, you would put it in further, right? Yeah.
Professor, Professor Suzanne wasn't sure about aspirating or not.
You don't aspirate.
We are not?
Mm-mm,
Okay.
no aspiration.
Bevel first, right?
IM doesn't matter.
I am, but that's for Subq, right?
So then apply pressure
And you apply
check.
pressure. So you already have that here, see? So you took it out. You have that here. You just put that on while you're doing this. Okay, so you're just saving yourself.
Throw it in the sharps and
Document.
I don't know how you
Push
do
up.
this.
Push
Oh,
up.
just push up. Okay.
Woohoo! Good job, David.